what should you look for in a plastic surgeon? Who should you go to? You should go to me, but the goal is to find a surgeon that you trust and be really clear with what you want to get out of the surgery, okay? When I see unhappy patients that have had surgery somewhere else, typically there was a communication problem. I think I'm a really good communicator, and that's what lets me get happy patients. So if you and the surgeon can line up on the amount of change you want to get and the amount of money you want to spend and the goal you're going to get out of it, then that's what makes people happy, and we're in this business to make people happy. I'm blessed with the fact that I have, thousands of patients, so I can be picky about who I operate on. The people I turn away are typically people that are asking me for something that I don't do well. So I'll say, man, listen, if you want a nose job, go to my partner, Dr. Diane. The best surgeon in the world and the worst surgeon in the world technically are closer on the skill level than you all think we are. It has to do with how many of these cases we've done and how much we obsess about it and think about it and nerd out about that specific portion of the body and that outcome aesthetically, functionally. That's really what it comes down to. I would be willing to bet I've done more jawlines than anybody in the world. It's just you can't physically do more of these than me currently. I'm like doing it unless you rush through the surgery. It's impossible. I operate every single day. It's all I do. You can't beat me on the numbers. And so because of that, I don't think you can beat me on the outcomes. And I'm just good at that. That's all I can say. How I approach the face, I would say cephalometrically, but within range. I mean, we have these clear cephalometrics that we use on people where we line up their contours, we look at their facial thirds, we have facial angles, facial fits, and we use those to kind of stay within range. But I got plenty of patients that want to go a little bit extra on the chin or a little bit tighter on the neck than the cephalometric would average. So on my pre-op quiz I have on there 1 to 10. I don't want anybody to know I want to look like a freaking avatar. Most people give me a 7 or an 8 on that scale, but we can do avatar and we can do super, super subtle. It just depends on what you want. That's the key. Who is this page for? I'm definitely into the, many people talk about confidence. I think I'm kind of next level. I don't give a fuck type of vibe. I really like people to own themselves, to be who they are. I like direct, honest, direct communication. I think I'm good at that, and that's what I deliver. So because of that, the people that I don't do well with are when I say, man, you just got to drop that 10 pounds. It's going to make the difference, I promise you. And then, they give me a bad review because I said to lose 10 pounds. Well, I mean, it's just my honest advice. You lose 10 pounds, I think you're going to get a better outcome. I'm going to tell you that if I think that's the case. If you don't want to lose the weight, that's fine. If you like being a little bit heavier, it's okay. But it will limit the outcome I'm able to give you. So yeah, take that for what it's worth. I do not like wearing a tie. So if you like your plastic surgeon to wear a 3-piece suit and a tie, my partner loves a 3-piece suit and a tie, so go see him. So those are things I think that probably people that are ruled out by me. I definitely would throw around a cuss word from time to time, so take that for what it's worth. I think there's some good literature on people that cuss are more honest and probably a little bit more intelligent than those that don't. So look up that article. Yeah.